Hello and welcome to lyranara.com and lyranara.me, and the subject of today's video is gonna be how to manage your blood pressure naturally in order to avoid complications such as arteriosclerosis, heart attacks, strokes, and of course for feeling better in general. And we all know that there are some solutions out there offered by mainstream medicine such as beta blockers or statins. But the unfortunate truth is that they come with a lot of undesirable side effects. So the question then is, are there some natural supplements out there that can help us with our blood pressure issues and our cardiovascular issues in general, and naturally side effect free? And the answer is yes, there are, and that's what we're gonna talk about today. And of course, as always, first we're gonna explain and try to understand how we develop blood pressure issues in the first place and cardiovascular issues, and then we're gonna dive right into the natural solutions. So let's first understand what are the real causes of too high or too low blood pressure. And many people think that blood pressure problems are a disease, but they are actually not. They are just a symptom. Blood pressure and all cardiac disorders are just an expression of different imbalances related to our lifestyle, such as chemical imbalances coming from wrong nutrition, hydration, smoking, drinking too much alcohol, heavy metal burdens, toxins, drugs and medications, as well as sugar and wheat poisoning. They also stem from emotional imbalances such as stress, depression, trauma, psychological shocks, as well as burnt out syndrome, and from physical imbalances such as our age, our family history, medical conditions that we suffer from, lack of physical exercise, being overweight, as well as kidney conditions and hormonal imbalances. What we also need to understand is most cardiovascular disorders are a result of blood imbalances, and only a very few are caused by real damages to our heart cells, our blood vessels' efficacy in transporting blood through our system, as well as kidney health and stress. Our blood is characterized by a very specific chemical composition, a strict pH range, as well as the content of carbon dioxide in our blood. And blood viscosity is mainly controlled by the degree of hydration, blood electrolyte content such as calcium, magnesium, potassium and sodium, as well as blood toxicity and its microbiology. And carbon dioxide concentration controls the blood vessels' perfusion as well as dilation. So when the stressors that we've mentioned already cause the central nervous system to change its biochemistry, the first reaction of our system will be to constrict the blood vessels to reduce the flow of CO2, and this can be felt as a chest tightness, or you cannot catch your breath, or you're suffering from short breath or even hyperventilation. And unfortunately, many times this is wrongly diagnosed as asthma, which it is not. When the blood vessels are constricted above the normal level, the heart, of course, must increase its pumping energy to compensate for this additional friction forces, and this will be felt as high blood pressure. Your central nervous system, as well as your autonomous nervous system, which are your body's control tower, they will trigger you to hold your breath to accumulate more CO2, so you will experience, for example, apnea at night. And these patterns are detrimental to heart activity and can result in increased blood pressure. Next, we need to understand the relationship between high blood pressure and arteriosclerosis. And it is said that a man is as old as his arteries, and blood vessel wall stiffness plays a very important role in high blood pressure management. But despite of thousands of studies, arteriosclerosis has never been correctly understood. In Western civilizations, everybody has arteriosclerosis due to arterial plaque created by many wrong habits such as wheat and sugar poisoning, lack of physical exercise, stress and emotional burdens, vaccines, alcohol and smoking, mercury and yeast overloads, or by microparasitical infections. Medical school explains arteriosclerosis as being blood clots that form in your arteries due to plaque, obstructing thus the blood circulation, enhancing blood pressure, or triggering a heart attack even. If this is true, then most of the heart attacks would happen in the gastrointestinal tract, because over there we have more than 83% of all of our blood vessels in our bodies. It is well known that arteriosclerosis affects all blood vessels, and therefore the question must be asked, why are the heart attacks all happening in the heart? And there is some presentations on our YouTube channel where we go much deeper into answering this question. But for this presentation, I would like to focus on some natural supplements that will help you avoid arteriosclerosis and manage your blood pressure, of course. And for arteries maintenance, you need to know that both the LDL as well as the HDL cholesterol are necessary. HDL cholesterol is the carrier and LDL is the so-called rebuilder. Therefore, we do not recommend to intervene in any way in the synthesis of cholesterol by taking statin drugs. Cholesterol is synthesized in the liver under the influence of vitamin D3 and K2, and therefore we also strongly recommend that you supplement your daily diet with those two vitamins. Vitamin D3 at about 10,000 to 40,000 units in combination always, of course, with K2 to lower your blood pressure. What is also highly recommended from us is that you supplement with coenzyme Q10 in combination with L-carnitine to secure a sustainable mitochondrial activity. Those two together are real food for your heart cells. And also, of course, take here L-carnitine 2 to 4 grams per day and 2 to 3 capsules of coenzyme Q10. For elderly people, we recommend that you take ubiquinol instead of Q10 because it's easier metabolized in your system. Studies have also shown that L-arginine helps your endothelial cells create enough nitric oxide to promote optimal blood flow and cardiovascular health. Unfortunately, nitric oxide signaling declines with age. This is a normal process, so if you are a healthy adult, your body will produce about 4 grams of L-arginine per day, but by the time you reach your 50s, if you are a typical adult, you are already somewhat deficient in L-arginine. Women tend to maintain their ability to produce this important amino acid longer than men, but still after the age of 40 to 50, you must take about 4 grams of arginine per day to remain healthy. Another natural supplement that we highly recommend, as it is literally a heart elixir, unparalleled in its effects on your cardiovascular system, is Strophanthine, also known as ouabain. It has many essential health benefits for your cardiovascular as well as your cerebrovascular system, and you can efficiently regulate your blood pressure with Strophanthine in combination with some other supplements that we've mentioned before. Strophanthine stimulates your sodium-potassium pump. It also stimulates the secretion of ACH to myocardium and to your central nervous system. It stimulates the production of nitric oxide in your arteries and reduces therefore oxidative stress. It also stimulates the ATP production in your heart cells. It protects your mitochondria against ischemia and reperfusion. It enhances the contracting power of your heart. It triggers many psychotropic effects as well, so you will feel much better and you will be in a much better mood. It stimulates your cardiac myocytes, cholesterol synthesis, as well as ubiquinol production. And it is the best option to treat angina pectoris, heart insufficiency, heart arrhythmia, and to prevent, of course, heart attacks and strokes. The dosage, however, must be customized for each patient, as there are patients that react better to a low dosage and others who need higher dosages. So please contact us at lyranara.com. You also find our phone number on our homepage for personal consultation on what works best for you. It's also far more absorbable than the often recommended digitalis and less toxic. So it has many advantages over digitalis and over many mainstream heart drugs. Zero side effects if you apply it properly in the right doses. And you can get the extra strength Strophanthine exclusively at lyra.me. I'm going to post the link in the description box below, of course, for you. But supplementation is not the only thing that you can do to maintain a healthy blood pressure and to maintain your heart and your cardiovascular system in general good health. There is a very nifty, inexpensive natural device called the INFERUM that you can also get exclusively at lyra.com that will help you with that. The blood pressure and the heart frequency adjusting during the day and the night, of course, based on different physical and mental activities, emotional stress levels, metabolic processes, and general health conditions. And to quickly adjust the blood pressure and to avoid cardiovascular and or cerebrovascular incidents, we recommend to use this nifty little device called the INFERUM. In only 2 to 5 minutes, the INFERUM will normalize your arterial blood pressure and the heartbeat frequency completely naturally. You can wear it on your wrist. It's very easy to use. And you can use it as part of your general high blood pressure maintenance and also as treatment in combination with Strophanthine and the supplements that we've described before. How does the INFERUM work? Well, it's very easy to use and inexpensive, as I've mentioned already. And it works through an inbuilt electrostimulative electrode that acts on your biologically active zone on your wrist. It's an electrical stimulation that contributes to the improvement and normalization of vascular wall tone and has a positive overall effect on regulating the body's physiological system. So you will need less drugs. It will help you reduce the number of drugs you take. You will have a more comfortable life. And if you use it regularly, it will also help you improve your mood and will give you an overall feeling of well-being. It also will help you against weather sensitivity. So if you are sensitive to weather changes, this is a great device. It reduces the effects of abrupt weather changes on your body. And this electrical stimulation occurs through a very weak electric current, which is barely perceivable. The device uses programs which differ from each other in terms of frequency, time shift, and amplitude. And the selection of one program results either in the reduction of the sympathetic dominance, which leads to hypertension, or the insufficient impact of the sympathetic nerve on the vascular tone, which leads to hypotension. Therapy effects of the INFERUM are that your arterial blood pressure will normalize, your overall physical condition will improve, your emotional state will improve, your ability to work will improve, therefore, and you will be able to reduce the number of drugs that you take. And I would like to show you how easy it is to use the INFERUM if you're suffering from too high blood pressure, also called hypertonia. Well, to reduce it, you use the zone MC6, which will be precisely described in the booklet that you get with the device. It is located on the inner side of your left forearm. And if you stimulate this zone, it will have a significant sedative effect on your cardiovascular system. And you can use it for cardiovascular diseases, arterial hypertonia, vegetative vascular dystonia with fluctuations in your blood pressure, as well as neurosis and sleep disorders. Session will take you only about 5 minutes, and you remove your watches or bracelets that you wear on your left arm. You roll up your sleeve. You attach the device and press just one button for reducing the blood pressure, and after the session is over, we recommend that you sit or lie down somewhere quiet and relax for a couple of minutes. We also recommend that you repeat the sessions 1 to 3 times per day over a 14-day period. If you're suffering from too low blood pressure, also called hypotonia, it's also very simple. To increase your blood pressure, you use the hand zone around the point TE5 that is located on the outer side of your left forearm. And again, it's a one-button operation, and that's just how easy it is. What can the Inferium do for you? What are the health indications that you can use it for? Well, first, occasional increases or reductions in your arterial blood pressure in stressful situations or during weather changes. It will regulate your blood pressure within 5 minutes, as we've seen. For arterial hypertonia or hypotonia therapy, and as well as an additional therapy to strophanthine and all the supplements that we talked about already. For early arterial hypertonia or hypotonia therapy, before you get beta blockers prescribed, and this is also when we advise you to change your lifestyle, your diet, to avoid bad habits such as smoking or drinking too much alcohol. You increase your physical activity and you try to reduce excess body weight. It's also great for the therapy of vegetative vascular dystonia of hypertonic or hypotonic nature, as well as for a secondary, so a symptomatic arterial hypertonia or arterial hypotonia for patients with endocrine renal pathology. When should you not use the Inferium? Well, when you're very, very sensitive to electric currents, even though, as we've mentioned already, this device uses very, very low, barely perceivable currents. But some people are very sensitive, so don't use it if you don't feel well with it. If you have a pacemaker implanted, please don't use it. Also, if you're suffering from neoplasm of any ethology or location, if you're suffering from acute fever of any origin, if you're also suffering from mental disturbances or you are under the influence of alcohol, and also do not use it if you're suffering from fluctuating arrhythmia. So let's wrap things up by summarizing what we've learned. Many of us, unfortunately, nowadays are suffering from blood pressure problems, which, when left untreated, can create even more severe conditions such as heart attacks and strokes, which we all, of course, don't want. Unfortunately, mainstream medicine is offering us a lot of drugs that have serious side effects, such as statins or beta blockers, and which even can make the situation much, much worse. And the good news is, though, that we have natural side effect frees available, such as strophanthine, coenzyme Q10, L-arginine, L-carnitine, as well as vitamin D3 and K2 that can help us maintain a healthy heart and cardiovascular system, as well as address many existing conditions. Strophanthine, by the way, if you're really interested in the success story of strophanthine, we have some presentations on our YouTube channel, and you can get it exclusively in a very high concentration that you cannot obtain anywhere else at lyranara.me. I'm going to post a link in the description box below, and strophanthine is really a miracle drug when it comes to a healthy heart as well as cardiovascular system. Also, ingenious devices such as the Inferium that I've presented to you in this presentation can help us regulate our blood pressure on the go and avoid further complications and get into a better mood and deal better with weather changes, etc. in an all natural side effect free way. This device is very inexpensive. It's very easy to use, one finger operation. It's all automatic, and you can take it with you anywhere you go. And of course, do not forget also to address your lifestyle. If you keep maintaining your bad habits or the wrong diet, too little exercise, all of the supplements will improve your condition, but you will not completely get rid of it. So please also address your lifestyle, sleep well, eat well, stop smoking and drinking too much, etc., etc., even though that can be difficult, I know, sometimes. And with that being said, if you have further questions, please contact us at lyranara.com or via email at shop@lyranara.com. You also can find our toll-free number on our homepage. I'm going to post all the links to the INFERUM and Strophanthin in the description box below. If you've enjoyed this presentation, then please like, share, subscribe, comment. We like to hear from you. And until next time, stay healthy.